96 that were included in this project. And the reason that there was only 96 included was because the article only chose people over the age of 65 and that they had to come in for an elective surgery. And there were a total of 91% of nurses that had used the CAM when they were assessing their patients, and the ability to detect delirium increased, and they were able to identify 13% prevalence of the post-op on delirium compared to 8% from the previous year. And on that these patients tend to have a longer hospital stay, a greater rate of readmission, and on that the majority of them required to be transferred to a rehab facility. This right here is my chart for the sources that I use to collect my articles. I had PubMed, I had Gale, and I had the CINAHL. And mainly what I searched for was the nursing interventions for delirium in hospitalized older adults, and I also searched for CAM for the confusion assessment method. And here are my references I use, which I will discuss even further for you. And this was the main article that I used for my research, and it was written by nurse practitioners, 3 of them, and one doctor. And the purpose of this article was to test for the post-op delirium using methods such as the CAM. And like I said, it selected patients over the age of 65 that came in for elective surgeries. And one of the things that I probably would have liked to see more of is if they would have maybe broadened the age range. But one of the things that I did like was that patients were assessed before surgery using a mini-cog, which is another assessment method that establishes the baseline cognitive function before surgery, so that you can try to understand if the patient already has any kind of cognitive issues. And these patients, they did require the longer hospital stay and had to be transferred to rehab facilities, like I said, on my board. And then I have this article about orthopedic nurses' knowledge of delirium in the hospitalized patients. And the purpose of this article was to assess AON nurses' knowledge of delirium in patients over the age of 65 and the effectiveness of the interventions such as the CAM. And this research was done on a 39-bed ortho unit. One of the strengths about this article that I like was that they opened the research up to anybody that worked at the hospital, as long as they have had 10 ortho patients in the previous year. And one of the things that I did not like about this article is that they excluded the use of LPNs. And while I know that some LPNs no longer work in hospital settings due to hospitals trying to switch mainly to an RN role, there are still some LPNs, that work on some units, and I would have liked to know their knowledge as well. And the results of this were, regardless of the years of experience, and there were many nurses that struggled to identify delirium and the proper interventions to increase positive patient outcome. And the last article I will talk about is that this one was written by doctors. Is delirium in the elderly patients and how you can help. And this article talks about how delirium is often misdiagnosed in up to 80% of cases, and that the evaluation of delirium early in the hospital stay can lead to better outcomes. Delirium is present in 10 to 40% of the elderly at the time of admit, and it increases 25 to 60% during the hospital stay, and that more than half of these patients are patients that have hip fractures. And delirium often goes unrecognized, resulting in delays and complications, and has been associated with 10 to 65% of mortality rates, longer hospital stays, and risk